Diploma and Advanced Anterior segment here at the University of Toronto in Canada.
Gator! And today we're gonna share some tips on how to improve your skills with your non-dominant hand. For eye surgeons, it's very helpful to be comfortable with both hands, especially when you're dealing with complex cases like the popular plunge. For this surgery, I'm placing multiple dyes for the iris tissue around the pupil. And now I'm holding the needle driver with my non-dominant hand, and I need to have a good control of the needle to avoid any iatrogenic iris defect. So as you can see here, if I use my dominant hand to hold the needle driver, the nose will be on my way. So it's going to be very hard to access for this incision. So if I use my non-dominant hand to hold the needle driver, I get a free access. So it's gonna make my work much easier.
I've decided to divide this surgical video into 3 steps. Step number 1, just use your dominant hand on your daily routine basis, such as your personal hygiene, brushing your teeth. We'll show you some examples. Step number 2, doing something fun with your non-dominant hand, such as a hop. Step number 3, and the last one, we'll leave it at the end because it's the hardest one, just applying your non-dominant hand while you're at work without slowing it down.
To begin your training, start with things that you do on an everyday basis, such as brushing your teeth with your non-dominant hand and also applying your makeup. If you feel brave enough, you can even try applying eyeliner with your non-dominant hand. Practice makes perfect. Doing your nails at home also helps, as you need to apply the nail polish in both hands. For the next step, pick a hobby that you like, but do it with the intention to train your non-dominant hand. It could be anything. Valentina picked a diamond painting where she's using her left hand to glue diamond by diamond. And Tissy picked a coloring app on her iPad where she can use her Apple Pencil to paint lots of great designs for free. In the last step, try using your non-dominant hand at work. This can get tricky because it will slow you down when you're starting. Things you can do are switching hands when using a computer mouse. If you work on a laptop, then you can use the touchpad with the other hand. Also, while in clinic, practice instilling the drops with your non-dominant hand, as well as carrying out the full slit lamp examination with it. A few things to consider. Don't get overwhelmed. Using your non-dominant hand can get quite frustrating. Start slow, practice only once a week, take breaks, no one is rushing you. Practice truly makes perfect. This is also true for becoming ambidextrous. If you're consistent, you will be able to become comfortable with your non-dominant hand. Last but not least, have fun. You will see things will come much easier if you start with a positive attitude. And now you're ready to carry out a full pupillary cerclage as my friend Tissy is about to do in this case.